So going to those different methodologies we discussed. So one of the aspects that we discussed was lean, and why we want to implement lean. And one of the things you heard about that you want to put in these weekly or daily routines, right? Where we get together, we ideate, we prioritize, like what we call in lean huddle meetings or huddle boards. So that's kind of one of the concepts of lean. How do you breed a culture of continuous improvements is making it visual, making it consistent. It's not something that we discuss in a quarterly meeting with our management team. It's something that we think about on a weekly and daily basis, right? That's kind of what you're trying to create here. And again, KPIs, deciding which ideas we move forward with and which ones we drop. How do you, create those incremental innovations or sustained innovations that we talked about, right? You first need to start with your current state, before you jump to those big disruptive innovations. So you start with what is our current processes and activities that we do on daily basis, and which ones provide value to our customer. And what it's defined in the lean terms is which activities are value-added activities from customers' eyes, and which activities are waste. They're non-value added, okay? So that's where I think you can start thinking about, when you start thinking about what do you need to innovate internally in the incremental way. Definitely, there's tons of required processes without which you cannot move to delivering your value-added things. But like in the healthcare, for instance, tons of those required processes, if you just look at them, there's a ways to improve or innovate so that people can spend more time with patients, so that physician or the administrative assistant can actually service the patient as opposed to sending 500 faxes every single day, right? And that's what we've seen in a client, diagnostics clinics that we've been working with. 500 faxes every single day, while the patients are sitting in the waiting room waiting to be seen. Well, there are solutions out there to automate that, right? So those are just the examples. And we've done, large lean transformation. It was actually not just applying lean tools, and that's one thing I always want to point out to people. People think of it as, which lean tool we're going to apply? Fishbone, problem statement, 5S. Lean is about actually culture. You start with changing people's thinking and how they go about on a daily basis thinking about their work and seeing inefficiencies in their daily work. And that's how you start creating those little small incremental improvements. The tools come later, or which tools you use for it, but you start with the thinking process, right? So this project's been going. They have 5 clinics all across Toronto region, North Toronto, Newmarket, Barrie. They had 50 people. They grew really, really fast. 20 cardiologists, tons of processes, patients waiting for a year to be seen, patients sitting inside the clinics waiting for 2 hours to be seen, all kinds of inefficiencies. So, it's still ongoing, but a lot of work has been done around mapping out their processes from beginning when the patient comes in to everything that happens while they're there, and so on, and to the time when the patient exits the clinic. We've done a lot of innovations, which is around with the people, of course, not us, the people themselves who do the work know best. Incremental, right? They've changed the layout, the physical layout, and how they move the patients in their clinic. From station to station, we call it. If somebody needs a cardiac test or echogram or whatever other test they need to be done, there's a way of designing the system so that the patient doesn't sit and wait in between tests, and also that the physician doesn't sit and wait to see the patient, right? So a lot of this resulted in innovations. You may not think about them, but they are innovation because their processes are redesigned and how they go about things. Another one is, I don't know, you can call it breakthrough, but as a result of all these improvements, we've been working with them and also seeing how they utilize their EMR, which is electronic medical record system that clinics use. And we realized that there's a lot of opportunities for improvements by automating for them to receive the tests on time so that when the patient comes in next time, you don't have to actually say, sorry, we don't have your test, you're going to have to come another time, or just cancel his appointment before they even get there. So those are the bigger innovations you can think of, right? And disruptive, it's not, I called it disruptive, but it's not. when you change the way physicians say deliver service to the patients, right? So if they're starting to see more patients, so in some cases, instead of a patient waiting, God knows for how long, for how many months, there's a way now for them to see those patients. They're less, potentially maybe less urgent patients, but they can still be seen by a physician. You don't have to, you don't need to continue always doing things the way you've always done, right? That's why we have technologies and new things. So that's kind of another framework of physicians changing the way they do things, and so that they can deliver patient care.